All right, hello everyone. My name is Sanjeet, and today I will be speaking to you about my practicum experience and the project that I completed for the Canadian Cancer Society. Oops, sorry, just one second here. Okay, CCS is a national community-based organization recognized as a leader of public health advocacy in Canada. Advocacy efforts include influencing government to pass policies which will prevent cancer, increase the access to quality cancer care, and enhance the quality of life for those living with cancer. I had the opportunity to work with the health policy and health promotion team in Edmonton, Alberta. The main priority for the health policy and health promotion team is primary care prevention, including reducing exposure to risk factors such as tobacco, which was the focus of my practicum. In its advocacy efforts to reduce tobacco use, the CCS Health Policy and Health Promotion Team is part of the Campaign for Smoke-Free Alberta, which is a coalition of 7 prominent health organizations, as seen on this slide. The coalition's vision is a healthier Alberta free from addiction and involuntary exposure to tobacco industry products. Since 2002, the coalition has been successful in ensuring smoke-free work and public spaces, a ban on all retail tobacco displays and sales in healthcare facilities and educational institutions, and several tobacco tax increases. In response to the Government of Alberta's review of the Tobacco and Smoking Reduction Act, the coalition launched an advocacy campaign to ensure gaps in the legislation and the current issue of youth vaping would be addressed. My project entailed developing an advocacy strategy and toolkit which would support the advocate campaign. Before I discuss what I did for my project, I will provide an overview of the current public health issue. We are all fairly familiar with the public health issue of tobacco use, which continues to be a leading cause of premature death in Canada. What is more concerning is that a new public health issue, youth vaping, could potentially reverse years of efforts to control tobacco use and create a new generation of tobacco users. Vaping products have gained rapid popularity among youth around the world. In Alberta, 50,000 youth reported vaping regularly in 2019. These youth are 4 times more likely to begin smoking later in life. It's weak regulations and the stealth marketing techniques of the vaping and tobacco industries, such as appealing ads and kid-friendly flavors, that are the reason we are facing a youth vaping epidemic. My final project deliverable was a 74-page advocacy strategy and toolkit document, which would be used to organize campaign efforts, including stakeholder engagement and government relations, and ensure resources were developed to support capacity building and mobilization. Parts of the strategy were determined by the coalition members, so I ensured that these were captured in the document as well. My major contribution to the strategy was the stakeholder analysis and participation in stakeholder engagement. I used components of the CCS health policy advocacy process, as seen on this slide, to develop the document. It's important to note that although it may appear linear, the advocacy process is iterative and components are interdependent. A policy analysis was completed and included in the strategy document. This considered new evidence that emphasized the strong association between youth vaping and progression to smoking, meetings we had with government officials, loopholes in the current act, and actions provinces across Canada had taken. The policy recommendation, which would be presented to the government, was to align restriction of vaping products with that of tobacco products, with a strong emphasis on a comprehensive ban of flavored products. The main goal of the advocacy campaign efforts to get the public and stakeholders to help with efforts to influence government. The strategy for capacity building was to educate and empower stakeholders by providing them with issue briefs and support packages so that they could reach out to their followers and felt comfortable approaching government. The support package included sample email blasts and key messages to youth. The mobilization strategy was encouraging the public to visit the Protect Alberta Kids website, where they could directly send letters to their MLAs regarding the public health issue and show support for the recommended policy solutions. The communication strategy included utilizing earned media and social media. The frame, which was Alberta youth deserve first-class protection from tobacco and vaping products, would be emphasized in all communication efforts. It was determined that Facebook and Twitter pages would be updated on a weekly basis and as new information was acquired. The strategy for government relations included identifying key government officials and their positions, determining their perspective on the current issue and their political platforms. When meeting with government officials, it was important that they felt the coalition was a partner on this matter rather than feeling like they were being blamed for the current issue. Resources developed for this component were issue briefs, which would be given during meetings. On March 4th, the coalition hosted a MLA information and discussion session in which all government officials were invited to. Stakeholders were considered a vital component of the advocacy efforts, and thus a major part of my role included determining who the key stakeholders were and how to implement and maintain stakeholder engagement. A list of key stakeholders and their level of support and power was determined. Key considerations were their previous involvement and interest in tobacco reduction, their level of influence, amount of resources, and their capacity to contribute to the campaign. A stakeholder map was completed to determine who the strong supporters were and those who would oppose. Based on the stakeholder map, roles for stakeholders were established and 7 champion stakeholders were identified. All stakeholders were invited via email to the March 4th MLA information discussion session. We met with stakeholders one day before the March 4th event and provided them with an issue brief, which outlined their roles and the key messages and policy recommendations to discuss with the government officials. The goal for the 7 stakeholder champions was to establish follow-up meetings with MLAs to further discuss policy recommendations. We had 25 out of 27, including the 7 champion stakeholders, attend. I was unable to determine how many stakeholders were able to get meetings with government officials, as we were still waiting to hear back from some of them. It was determined that contact with stakeholders would be maintained via email as new information or events were established and via weekly posts on social media. It was recommended that debriefs meetings occur shortly after any major events that stakeholders were invited to, as this was not done after the March 4th event, and potentially resulted in lost opportunity to engage government officials. Finally, the evaluation and monitoring component of the strategy and toolkit document was key in ensuring actions were being carried out on time and adapted as needed. The questions on this slide were among the ones that were included in the document. So, public health implications. Advocates have been tackling the issue of tobacco use for decades, and despite the many successes, it's an issue that continues to harm the health of millions around the world. Having a multi-pronged strategy in place ensures that the advocacy efforts are organized and effective, and actions can be adapted easily if needed. Communicating an effective frame is extremely important. Historically, smokers have been blamed for smoking and their poor health rather than the tactics used by the tobacco industry. The issue must be framed to illustrate how poor regulations and the actions of the industry have failed some of our vulnerable populations. It is these frames that have ensured effective tobacco legislation have been implemented. Similar framing is important to tackle the vaping issue, as evidence shows the vaping industry has used the same techniques of the tobacco industry to target youth, such as making an abundant number of flavored products. Unfortunately, scientific evidence in this case is not enough, as we are competing with the tobacco industry, who has an abundance of resources and financial support, as well as influence on policy. In Alberta, there are 22 tobacco lobbyists, some of whom have good relations with government officials and have already met with government to discuss the review of the Act. Thus, coalition building is crucial so that organizations can compile their resources, intelligence, and support one another. Collective voice will have a stronger impact on government. In addition to multi-sectoral collaboration, getting the public involved and standing as a united front will put more pressure on the government to regulate these products more strictly. It will emphasize public well-being is more important than the industry interests. Finally, it's recognized that there is potential that not all policy recommendations during this campaign will be adopted by the government. As such, an advocacy strategy and toolkit is a valuable resource to have, as it will prove to be beneficial for future efforts. By utilizing the strategy and toolkit for future efforts, CFSA can tailor its approach and attempt to have success with some of the policy recommendations that might not be adopted immediately. So this concludes my presentation. I just wanted to take this opportunity to thank Angeline Webb, Les Hagan, Kristen Berry, Nigel Livingston, and Betty Taylor for all their guidance and support. And just wanted to say congratulations to everyone for doing such an awesome job. Thank you.
Well, that's great, and congratulations to you. Excellent presentation. And I see there's already a question from Chantel.
Hi, Sanjeet. Great presentation. I did have a question. Did you experience any challenges with your stakeholders?
We did initially. So after I had completed the stakeholder analysis, and some of the stakeholders that we had identified that we felt would be very important for this campaign, unfortunately, couldn't participate due to their position in society. So some of them were health officials that needed to remain neutral on this issue, which was unfortunate. And then we did have some from the education sector that were unable to participate as well, again, because it became political at the end. I hope that does that answer your question?
Yes, it does. Thank you.
Yeah.
Were there any other questions? Lots of comments coming in. Oh, there's a question, yes, from Jessica. So go ahead, Jessica. If you wanted just, Jessica's mic isn't working, so if you just wanted to type in your question. So
I think I caught it. Was it something regarding if this will be used for
future projects?
Yeah. So it's a tool that my practicum supervisor was hoping to use for future projects as well, with policy and specific and just regarding tobacco. Not all policy recommendations are going to be adopted immediately, and that's just reality, just from what we've seen in the past. And so this obviously will be used to help or try to get the government to pass other policy recommendations if they're not adopted immediately. And then other stakeholders can actually use this this toolkit as well. So with COVID happening, the Canadian Cancer Society had to halt their efforts on this project, but some of the other coalition members were still able to continue on. So this hopefully will be a useful resource for them.
Thank you. And there's time just for one quick question. Andrea, you have a question. Go ahead and ask your question. Okay, again, a microphone. If you just wanted to type out your question in the chat box. So the question was around the stakeholders, how you found them and recruited them.
So some of the stakeholders were already involved. So phase one of this project was started in May of 2019. And so there was a stakeholder engagement session that happened in October. And that was just to make them aware of that the review was happening. And so I had taken a look at that list and reviewed notes from that meeting. And then I did a Google search to see if there was any other organizations out there that were also involved in tobacco reduction, and if they were, how vocal they were, what kind of work they had done. And so once we had compiled that list, I reviewed it with my practicum supervisor, and then we just contacted them via email. So it was just reviewing their website, and just contacting them and seeing if they would be interested. So we provided them with a letter of invitation and a support a support letter as well that basically talked about what we were going to do and the policy recommendations that we were going for.